The CDC says people with underlying health conditions are more susceptible to being hospitalized or even dying from the coronavirus. The one thing we don't know is how many people who died in Michigan from COVID-19 had underlying medical conditions. The Michigan Department of Health and Human Services said there's a reason those numbers are not being released.
What we're seeing in hospitals is that even though someone may have COVID-19, they may be dying from a stroke or something else that may be related to it. So we'll have to flush all that out in the data. That
was Michigan Chief Medical Executive Dr. Journalistic back on April 29th, saying she would look through the data of COVID deaths with underlying causes. Now, several weeks later, no new data. Doctors like Dr. David Geyer say it's important for everyone to understand that underlying conditions like cardiovascular disease, chronic liver disease, lung disease, or any other medical condition compromises your immunity, making you more at risk of dying from COVID-19.
And that's why this data is really important. If we have this data, we can, and just keep sort of adjusting course and navigating without having potentially to do huge lockdowns of the society. And I think that's potentially good for the population.
Take a look at how the Alabama Department of Public Health is releasing statistics. As of June 30th, 905 people died from the coronavirus. It goes deeper and tells you 867 people had underlying medical conditions. 38 of them had no underlying conditions. Kent County Medical Examiner Dr. Stephen Cole said this is important information every state health department should be releasing.
I think it would give the public a more nuanced understanding of this. In other words, is everybody, even healthy people, young people, are they at risk for going out in public, or are they not? And are they being needlessly overcautious and to the detriment of themselves and, say, society in general, businesses and so on?
The state of Michigan is not releasing this information. MDHHS put me in contact with Jim Collins. He's the director of the Communicable Disease Division, who says gathering all the data is not as easy as it seems.
We don't have a lot of confidence in those numbers. That what we're seeing when we look at those cases, when we look at the case follow-up, many of those are unknown. That doesn't mean Michigan's not contributing to the discussions and contributing to the science nationally. When you have very small pools of information, reporting out at it can kind of misrepresent things.
Michigan does break down COVID deaths by sex, age, race, and even tells you the number of people who have recovered. Collins would like to have all of the data on underlying conditions, but says it's just not available.
While we don't have the exact counts for Michigan, because again, that data is unstable and not very complete, we do have these risk factors that we share every opportunity we have about vulnerable populations.
Collins said one big reason for the lack of in-depth information is local health departments aren't providing it.
The investigations that are conducted by local health jurisdictions would indicate that information if they have time to get to all of our cases and do the investigation.
Dr. Cole said that's disappointing because the public needs to know that the risk is not equal.
The public needs to know what is the relative risk and who is at risk for contracting this disease and who's at risk for dying of it.
The CDC just released new data on COVID-19 and underlying conditions. 90% of the people hospitalized in the country all had at least one underlying condition, with high blood pressure and obesity topping the list. As for those who have died in the country, 93% of them had underlying conditions. Michigan's Chief Medical Executive, Dr. Journalistic, says it's true that not everyone is at equal risk.
The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions.
States like North Carolina was one of those states that used underlying conditions to lift their stay-at-home order 3 weeks ago, opening restaurants, hair salons, and all retailers. Just weeks ago, after lifting those restrictions, the number of cases of coronavirus over the past few weeks has started to inch back up. Governor Gretchen Whitmer says it's all about letting the science guide her decisions.
We're always looking at the number of tests performed, the rate of positivity, where our hospitalizations are.
Dr. Cole says this should not be about politics. It should be about the risk.
But I think as long as everybody understands the relative risk, I think people can go about their daily lives, and maybe we can get back to some semblance of normal.
Several states that are open are going in reverse. Well, they're closing back down. Those include Ohio, Florida, Texas, California, and Nevada. Now, I contacted the health department in every one of those states wanting to know if underlying conditions was a factor in the uptick, but no one has gotten back with me. I reached out to several lawmakers in mid-Michigan. None of them wanted to comment on this story. Now, you can take a look at how different states break down coronavirus numbers right now on our website, midmichigannow.com.